An estimated 1 in 133 Americans, or about 1% of the population, has celiac disease. It is estimated that up to 83% of Americans who have celiac disease are undiagnosed or misdiagnosed with other conditions, and sometimes it can take 6 to 10 years for someone to be correctly diagnosed. Patients with type 1 diabetes or certain genetic conditions like Down syndrome and first-degree family members should all be screened for celiac disease. And if you're a dentist, listen up. Dentists should screen patients who have enamel defects and recurrent canker sores for celiac disease. Now, as healthcare professionals, we know that celiac disease is an autoimmune disease, and the only treatment is a lifelong gluten-free diet. But do you feel confident answering your patients' gluten-free diet questions? I'm Colleen Sloan, Registered Dietitian and Pediatric PA, and this is the Exam Room Nutrition Podcast, where each week I give you answers to common nutrition questions. Now, if you like my podcast, you'll love my nutrition newsletter that I send out every Sunday morning. It's free to sign up if you'd like to stay up to date on nutrition news, so you can sign up at examroomnutrition.com/sign up or check the show notes for a link to sign up. Well, I'm so excited for today's topic because we're going to unpack exactly what a gluten-free diet is and who needs to follow one. Now, spoiler alert, despite how trendy it may be, a gluten-free diet is not for those looking to lose weight or, quote, eat healthier. We're also going to discuss what you should instruct your patients to look for on a food label and ingredients list, and we'll answer the common question of, will eating a crumb of gluten harm me? Now stick around to the end where I remind you of important lab tests you should consider in the management of patients with celiac disease. So get comfy and join me in welcoming Selena Devries. She's a registered dietitian living with celiac disease who specializes in celiac disease in practice. She has a dietetics degree from the University of British Columbia, is a Monash University trained FODMAP dietitian for the treatment of IBS, and has had 5 years of experience being on the national board with Celiac Canada. She has an online virtual private practice offering one-on-one services and group programs to help people thrive on the gluten-free diet. You can find her on Instagram at Celiac Dietitian. Selena, thank you so much for being here. Welcome to the show.
Thanks so much for having me, Colleen.
I really want to start off by clarifying something that I think is super important to address, the difference between celiac disease and gluten sensitivity.
Yeah, that's a really good question. Good differentiation that we need to clarify there. So celiac is an autoimmune disease, right? And so that does involve the immune system. And so when gluten is ingested, even in really tiny amounts, that elicits an immune response. And so you can think when gluten's ingested, think of it as a foreign invader. And what happens is your body attacks that gluten protein. And in the process of that, it actually damages. And so this can lead to symptoms from GI issues to joint pain, fatigue, headaches, migraines, all of that. And so people with celiac need to be very, very careful with tiny amounts of gluten. On the other hand, when we're talking about a gluten sensitivity, or what might be better known now as non-celiac wheat sensitivity, is when people ingest wheat, there is not that immune involvement. And so there is no small intestinal damage. And so people with this particular condition often can have varying amounts of different amounts of wheat. They don't need to be really, really careful with tiny amounts as someone with celiac.
I'd like to linger here a little bit and get your thoughts on individuals who have no celiac disease or no gluten sensitivity and following a gluten-free diet for health benefits. If you could just touch on that a little bit. Is there any merit behind this claim, or is it just kind of because people really want to be on a diet?
A lot of people can be following gluten-free diet for varying reasons. And I think with the research now, there's different components in wheat, particularly, that can cause issues for people, right? So there's fructans that are found in wheat as well. This is part of the FODMAP family. Anyone's knowledgeable on the low FODMAP diet. And so people following a gluten-free diet do and have improved symptoms because of the reduction in fructans, which makes them feel better. So if you're having symptoms and you're trying to figure out why, there can be varying reasons, right? It could be celiac disease, it could be a wheat allergy, it could be a fructan sensitivity, or it could be a wheat sensitivity. Like there's a lot of different things to differentiate there. But if you're just following a gluten-free diet because you think it's healthy, a gluten-free diet often is not a healthier diet. it's usually a lot lower in fiber compared to a gluten-containing diet. And so there isn't what I would say health benefits towards it. You really need to be paying particular attention to the fiber content on a gluten-free diet. And it's not necessarily healthy all on its own by any means.
That was a fantastic answer. It's always a hot topic of like, I'm going to go on gluten-free because I want to lose some weight or whatnot. So I think that's important for clinicians to be aware of, that it's not always a healthier diet and it might not be the best choice for your patients. So before we even dig into the components of a celiac diet, I wanted you to just kind of explain to us what the patients are going through when they're diagnosed with celiac disease and what that emotional and maybe physical toll is to them as the patient when they have celiac disease.
Yeah, this is a huge topic in celiac. I think we're seeing a lot more research on this too in the last 5 years on just how much of an impact on people's quality of life it has. And there's been a lot of research on it. There's a 2014 study that looked at the quality of life with celiac disease, and they compared the burden of celiac to these other chronic illnesses. And they found that celiac disease actually had the largest burden on people's lives aside from end-stage renal failure. So it came above inflammatory bowel disease, hypertension, congestive heart failure, irritable bowel syndrome, diabetes. There's also an association between increased anxiety as well. So there was another 2021 study that showed that 80% of people who were single that had a diagnosis of celiac disease almost met the clinical cutoff for a diagnosis of a social anxiety disorder. And so it does tell you, how difficult it is to implement and maintain a strict gluten-free diet, because it's not just about food. It really isn't when it comes to gluten-free, right? It's about how this diagnosis significantly impacts your ability to enjoy food, connect with others over food, and feel more at ease around food. You can't hide your diet, right? When you go to somebody's house on a food-based event, if you bring your own food, people are going to ask, why are you eating your own food? Or if you don't eat, people ask, well, why aren't you eating? Or you need to talk to the host to accommodate your needs. So you can't hide from celiac disease, right? And often depression, social anxiety, stigmatization often accompany the celiac diagnosis. And I think it really speaks to the importance in celiac disease for multidisciplinary care, because it's not just eating gluten-free. It's much more complex than that.
I think that's such an important thing for clinicians to be mindful of, not only at the initial diagnosis, because yes, I'm sure that is shocking and it's a complete lifestyle change, but for the duration of their life, because birthdays pop up and holidays pop up every single year. So I love that you bring that multidisciplinary approach into it. And it's not just like, hey, here's a gluten-free diet, follow this, have a great day, see you next year. It's way more complex than that. And so I'm glad we touched on the burdens of celiac disease and how it affects the patient's entire body. Let's give us some celiac disease terminology 101. I would love for you to define what is gluten and the foods that contain gluten that they, should be avoiding, because I think that's an important foundational thing that all clinicians need to be aware of.
Yeah. So gluten is a protein, right? It's found in barley, rye, and wheat. And then oats are also included in this, regular oats, and they are often contaminated with barley, rye, or wheat, mostly barley and wheat. So we need to avoid all of those different grains, and those can pop up in many different foods and many different ingredients. And so first and foremost, that's what gluten is. We need to avoid that.
So let's get into the diet. What do we say to patients who have celiac disease? The diagnosis has been established already, and they, ask us, hey, what am I supposed to eat? What can I eat? And I would love for you to not only give us the what, but help us as clinicians understand the why so we can explain that to our patients. Because I think knowing why they have to follow this diet is really important to helping them stick to it and, maintain a gluten-free diet. So I would love to hear how we as clinicians should answer that question.
So GPs, they have a really small amount of time with patients. And so when it comes to putting the burden on them to teach the gluten-free diet, that's probably not the fairest thing to do, because it is quite complex and it is encompassing. And so I think the first thing that should pop into a GP's mind when a patient asks them, like, well, what can I eat, is we need a dietitian referral here, right? We need that dietitian to be involved in their care, because the use of a specialized dietitian has been associated with improved gluten-free diet adherence. It also has been shown to reduce healthcare costs and save the hospital money in relation to long-term follow-up care with people with celiac disease. Now, on the flip side of that coin, I know that patients want an answer and they want it quickly. And so I think the why behind eating a gluten-free diet is important for people to understand that they need to be strict with the gluten-free diet, right? And so we do know that if somebody were to continue to eat gluten, they do raise their risks for continued healthcare problems, right? And so that could be, if they continue to eat gluten, that can be something as serious as small intestinal cancer or lymphoma. They can increase their risk of infertility. It can also elevate their risk for osteoporosis or low bone density, which then can contribute to fractures and all of that. And so as a doctor, what you could say is, looking at eating foods that are labeled gluten-free. So foods that are labeled gluten-free are regulated to be celiac safe, right? And so when you think about celiac safety, that's no more than 20 parts per million of gluten in a gluten-free product, and that is celiac safe. At the same time, I think many people, when they're first diagnosed, they start to really move towards a lot of these gluten-free packaged foods. And we do want to emphasize the importance of naturally gluten-free foods as well. And there's a whole host of reasons for this, right? Often these are much more budget friendly, right? So the cost of the gluten-free diet is expensive. It's 180% more than a gluten-containing diet, which is pretty crazy. It also helps to bridge the gap for nutrients of concern on the gluten-free diet. And it also helps people find relief of their symptoms, because these naturally gluten-free foods are great sources of fiber. So we're thinking things like quinoa, rice, fruits, vegetables, plain proteins like chicken, fish, tofu, beans and legumes, cheese, yogurt. All of these foods are wonderful, naturally gluten-free foods that should be a focus on the gluten-free diet alongside some of these packaged gluten-free packed foods.
You mentioned that the gluten-free terminology on a package is regulated. So I want to linger here a little bit, because I think, reading food labels is very important as a celiac patient. So I would love for you to give us some other buzzwords or things that patients need to be on the look for on food labels to determine if a food is actually safe for them to eat or not.
The first thing is that gluten-free claim or a certified gluten-free logo, those are safe. It's always good to do a second look at the ingredient list to make sure, but those are celiac safe. Aside from that, right, in the States particularly, if something is not labeled gluten-free or it doesn't have a gluten-free logo, then there are other words that you would need to scan that ingredient list for. And so one of them is wheat. And so you can look in the ingredient list or a contains statement. So the contains statement is an allergen statement on a food product. And so wheat, if it's in there, needs to be in that word, that plain English language word, just wheat. It won't be hidden under anything else but that word in the ingredient list or contains. So you want to search for that word. If that's not there, then you might need to search the ingredient list for other tricky words that could potentially mean gluten. And this would be barley, rye, oats. Again, it's just regular oats here. Malt, brewer's yeast, and yeast extract. Those are some other tricky words that you would need to look for on particular food products. Now, depending on the food product, there might be other words that you might need to look at. But by far, that is a big proportion of it.
I really like how you mentioned earlier the big list of foods that are naturally gluten-free, because that kind of eliminates the need for this investigative approach on food labels. And honestly, it sounded like it's a really general, well-balanced, healthy diet. I mean, fruits and vegetables, most lean natural proteins, beans, that sounds like what most healthy adults and Americans should be consuming. So I think that's an important thing to point out to celiac patients is like, hey, look at all these foods that you can safely eat, no problem. And then maybe direct them to like, okay, here are the few buzzwords that you need to be looking for if you are going for a packaged food item, because let's face it, it's convenient for everybody. So they do need to have some options. Now, when we talked about oats, you had mentioned cross-contamination. So I would love for you to explain what cross-contamination is and where it would pop up, because it's not just within the supermarket, but possibly even at homes, and who actually needs to worry about cross-contamination.
Yeah, so cross-contamination or cross-contact is speaking to the very same issue, just different terminology. But basically, cross-contact with gluten means that gluten's accidentally gotten into your meal during the cooking or the preparation of your gluten-free meal. So all the ingredients are gluten-free, and then somehow something happened during the cooking and processing that gluten got in there. And so a perfect example of this is double dipping, right? So think of like your peanut butter toast, right? So you got a knife, you dip it into the peanut butter, and then you put it onto your regular toast. You take that same knife, you put it back into the peanut butter jar, and then now you spread that onto your gluten-free toast. That double dipping is a cross-contact hotspot for people with celiac disease. So they do need to have their own condiments or be on the lookout for that at other people's homes. And so everybody with celiac disease does need to minimize cross-contact in their diet. But my goodness, is there a lot of misinformation on this on the internet and in different social media forums that people need to completely revamp their kitchens or replace every single piece of equipment that they have in their kitchens. And that's just really not true. We do have research now that suggests that you can just wash things up, right, with soap and water, and it be completely celiac safe. So that goes for things like your pots, your pans, your cutting boards, whether that be wooden or plastic, your wooden spoons, your pasta strainers, and so much more. You can wash these things and still use them for people with celiac disease.
I'm so glad you mentioned that, because when I was in school, I actually remember learning that a celiac family had to have like 2 of each things. And I thought that's so overwhelming and burdensome for a family. I mean, who can afford that, especially nowadays? So I think that's a really important point to make. So I wanted to get to your Instagram post that you have, and it says, "Will a crumb of gluten harm you?" And I love that, because I think that covers 2 sides of the coin here. The one side of the celiac patient who is so fearful of that one crumb that it might really trigger an inflammatory response. And then on the other side, we've got like the naysayers and the haters who are like, one crumb, you're going to be fine. You can have a little piece of whatever, this one crumb isn't going to harm you. So I love this post, and I really want you to kind of answer that question of, will a crumb of gluten harm you?
Yeah. So the answer is a crumb won't harm somebody with celiac disease, right? So if you think about a breadcrumb, think about buying a package of breadcrumbs from the grocery store, right? If you were to open up that package of breadcrumbs, it'd be 20 breadcrumbs. That would lead to the 10 milligrams, which is that international threshold of safety for people with celiac disease. So it's not one crumb, right? It's much more than that. And so there's a lot of fear, a ton of fear and misinformation in the celiac community. And so just trying to communicate that in that post, that's what I was trying to do, is to help give people a little bit more ease in their gluten-free life. And on the other hand, right, when we're out and about and we're socializing with loved ones or with people we might not very well know, this is where explaining to them, like, yeah, a crumb is too small. That's going to be damaging. That right away, when they say a crumb, okay, I need to be careful here, right? And the whole point of socializing around food is to try to make it easy, to try to get people to understand the seriousness of it, that this isn't just a preference, that I need to strictly eat gluten-free due to a medical condition. And when you say to other people, I can't have a crumb of gluten, that gets the message across very quickly.
Great point. And I love that post. And I'm so appreciative of the work that you're doing in the celiac space to eliminate that fear and help celiac patients just live a normal life and eat with the rest of society, because I think that is so important for them. All right, Selena, we have a really good understanding of what the gluten-free diet is and what it isn't. And I'm curious if celiac patients should all be recommended any vitamin or mineral supplementation, if there are any certain things that are, missing in their diets that general practitioners need to be aware of.
Yeah, so there are nutrients of concern on the gluten-free diet. And I think this is where personalized blood work and supplementing based off of that is really, really important. So with celiac disease, we know that about 70% of patients will come with iron deficiency. Usually that's actually one of the only symptoms is low iron or iron deficiency. And then you screen for celiac disease. So iron is definitely something that should be screened upon diagnosis. And if deficient, then a supplement should be started. Same with vitamin B12. Vitamin B12 isn't as common, not nearly as common as iron, but it can be low in a subset of celiacs. And so it is important that that be screened as well, especially if the patient is coming up with symptoms like a sore red tongue or other traditional anemia symptoms, right? Fatigue, low energy, that type of thing. And then another nutrient of concern is folate, and that is often low in people with celiac disease. And dependent on where you live, you might be able to test that or not. And then a bone density screen is important about 1 year post-diagnosis, and that is because there is an elevated risk of osteoporosis in adults with celiac disease. And so a calcium and vitamin D supplement might be needed, especially with people with celiac disease. They tend to just start eliminating dairy right from the onset. And so this can then even further increase their risk of osteoporosis. And so that is a really important topic to be addressed like by the dietitian or whoever is reviewing their nutrition, because it can be quite low. And I would say a low dietary calcium intake is the biggest thing that I see in practice, and probably the supplement that I recommend people to be on most consistently.
That was really, really helpful, very informative. Now, I think I know the answer, but can supplements or vitamins contain gluten? And is this something that we also need to educate our patients about when they're shopping for a vitamin or mineral supplementation?
Yeah, so it is possible for a supplement to contain gluten. I would say it's not something that I see commonly, but you do want to look at this on the ingredient list. And so many supplement companies will state that there's no gluten added in the supplement, or the supplement doesn't contain gluten, or it might even be certified gluten-free. There are some supplements out there that are certified now. And so what you want to look for on your supplement is some sort of terminology that it doesn't contain gluten, there's no wheat, barley, rye added to the supplement, or a gluten-free claim or logo on the supplement.
So helpful. Okay, I love closing out all of my interviews with this question, and that is, what advice have you heard or you want clinicians to just absolutely stop telling individuals who have celiac disease?
Yeah. So please stop telling patients to Google the gluten-free diet. The internet, like we mentioned multiple times already in this chat, is that there's a lot of misinformation on the gluten-free diet. And I think doctors really need to think about the gluten-free diet as a medication, right? So, just like type 1 diabetes, medication for that is insulin. There might be a conversation on the dose, right? Follow-up care, medication interactions, all of that. And so doctors really need to think about the gluten-free diet as a medication, and that it deserves the same careful planning just as a medication would. Same careful follow-up just as a medication would, because it's the only medicine available for people with celiac disease is the gluten-free diet. There isn't anything else. And so the best person to really help somebody thrive on that gluten-free diet is a dietitian, but please avoid telling patients to Google the gluten-free diet.
What would be 2 to 3 of your favorite resources that we can maybe direct our patients to before we refer to a dietitian, or if they're looking for more information, that are credible and are excellent sources of information for a gluten-free diet? And I'm going to go ahead and link those down below in the show notes.
Yeah, so I think there's a few different resources. There are some websites that can be particularly helpful. I like celiacnow.org. So that is a great website that has a ton of celiac education resources that are up to date and really helpful. And then another resource is Beyond Celiac. They have a lot of different, it's really nice to keep up to date with like the research that's going on in celiac disease. And they have a really nice area there that summarizes a lot of the recent research that's being done with celiac.
That's perfect. And then I would love for you to share us where people can hang out with you, because I know you have a private practice. So let us know about that. And if you're on social media, where everybody can find you.
Yeah. So on Instagram, I am there at celiac_dietitian. And we do lots of fun things on my account. So every Tuesdays, we do Q&A. So you can submit questions through stories. and I will answer them. And then on Wednesdays, we do quizzes. Those are definitely top 2 feedback. People love those. And then in terms of my online practice, you can find me at selenard.com. And I do all online virtual work. So I do have clients in the USA as well as Canada.
Awesome. And there is no excuse for my listeners if you work in the celiac space why your patients should not have their own registered dietitian like Selena, because as you can tell, celiac disease is complicated, but it's doable. So get Selena on board or another registered dietitian with all of your celiac patients for sure. Selena, thank you so much for the gift of your time. I can't give this back to you. I'm so glad I was able to get you on the show. I would love to have you back on again, but for now, thank you so much for being here.
Yeah, thank you for having me.
All right, now it's time for My Nutrition Notes, where I share some final thoughts and reminders. Now, maintaining balanced nutrition while following a gluten-free diet can be challenging. This is because many essential vitamins and minerals like iron, vitamin D, calcium, vitamin B12, folic acid, and zinc are found in gluten-containing grains. Additionally, gut damage from celiac disease can hinder a lot of different nutrient absorption. Now, targeted supplementation based on a patient's lab findings or even a multivitamin and mineral supplement may be beneficial for some. So I wanted to give you a list of labs you should consider evaluating at the time of diagnosis, as well as regularly during follow-up. So this way you can tailor your recommendations for each patient. You should definitely order an anemia profile looking at hemoglobin, hematocrit, folate, ferritin, and vitamin B12. Consider a vitamin profile looking at vitamin B6 and B1 and vitamin D. Also looking at mineral profile, especially copper and zinc. You want to get a lipid panel, electrolyte and renal profile, a CBC, and consider checking the patient's thyroid hormones, the TSH and T4. And especially adults with celiac disease, they need to have a bone mineral density scan within the first year after diagnosis. And that's all I've got for you today, guys. I hope this content was helpful to you. As a reminder, if you want to get my free weekly newsletter, you can sign up at examroomnutrition.com/sign up and come hang with me on Instagram at examroomnutrition. If you have any questions or any further topics that you would like me to cover, I would love to hear from you. And as always, let's continue to make our patients healthier, one exam room at a time. I'll see you next week.